So a lot of us hear about innovation pretty regularly, enough so that it's almost like politics or sport in that we all have an opinion about it, we all have teams that we like, and we all know what works or what doesn't work, especially as we do so. Now, much like politics and sport, almost all of us don't really know what it is. So if I were to ask any one of you, what is innovation? The vast majority of you would give me quite different answers from each other sitting in this same audience. The reason for that is it's really hard to say whether it's about invention, is it about some improvement in process? I think it's something much, much simpler than that. And that is, it's the idea that we are willing to say yes when saying no is so much easier, especially in our industry within healthcare here. Now, innovative professionals, as opposed to leaders, is what I want to concentrate on today. So when we talk about leaders, we think about chief executive officers, chief innovation officers, chief medical officers, but we forget that nurses lead patients towards goals. Caregivers are helping their parents make sure that they can get and be safe. So leadership in healthcare happens all over the place, and in a multi-trillion-dollar industry, we cannot focus our attention on just at the top. So this conversation is really about how can everyone in the healthcare industry, starting with its professionals, learn to say yes and go forward from there. Now, I talk about politics a lot. I come from the Washington, D.C. area, so you're going to see a little bit of politics come into this, but not too much. No reason to get scared and run off. First, let's take a look at Harvard Business Review, New York Times, Wall Street Journal. Everybody has ideas around what innovation is. Say, it's a lot easier to see where innovation is not. So for the things that we would like to say, this is innovative, that's innovative, what we end up thinking about really is the thing that's useful to us. But if we're trying to help each other out and to become more innovative, what should we focus on? I think we should focus on two things. The areas that are not innovative, the ones where people are waiting for commands and instructions, waiting to get an answer to hopefully the answer to yes for something that they want to do. And secondly, they're really just sitting around waiting for instructions for what to do next. So if you look at these kinds of areas and the area that Wall Street Journal, New York Times, etc. focus on are not the ones that we see every day. We hearken back to innovation in times like this. How many of you remember the campaign, Barack Obama's 2008 campaign? Some of you probably, hopefully remember it fondly. Seems like such a long time ago in a much more pleasant and easier time, doesn't it? Well, how many of you believe that innovative campaign did changing the world the way that it wanted to? I mean, do you believe that it accomplished the mission and the goals that it set? Just quick show of hands. Just a few. Why is that? What happened? What happened with the world's most innovative campaign? And going forward, what I'd like to talk about is and why that stopped the innovation in that campaign. So many of you have seen this particular quote before, that culture eats strategy for breakfast because it doesn't really matter what we want to do. It's almost always what we are allowed to do. So back in the 2008 campaign, I was actually a tiny, tiny cog in the wheels of the government machinery. I was asked to assist the transition team, in that case the 2008 Obama transition team, with technology and how they could use the same technologies they were using outside in the campaign inside of government. Well, these guys, exceptionally bright, very experienced, and it didn't matter whether you were Democrat or Republican, they had some great ideas and they were running 100 miles an hour. As they came into government, they hit a brick wall. Why did they hit that brick wall? Well, because one of the world's most innovative campaigns ended up meeting with the world's oriented culture. And permissions-oriented cultures are things that some of us recognize, especially me as an immigrant. Recognized it because when I was young, as a South Asian Texan boy, I realized that many of my fellow students in high school were allowed to do things that I was not allowed to do. So as I was going at home, there were things that I would love to do. This, it was like, son, that's really nice, but that's not how we do things. A new idea for son, that's great, but that's not how we do things. And many of you have probably heard that in healthcare quite often. And as you think about the way that healthcare establishes this culture, it harkens me back to another part of my career, which is as a computer scientist. So again, as I was younger, in a South Asian Texan home, many times hearing the word no, I looked for things that allowed me to see yes more often. So as I look towards a different kind of career, I'd say, okay, where is a place where I can have a bit more freedom? And about the age of 9 or 10, I ended up seeing computers, computer programming. Culture is one in which no one gets to say no. If you want to do something, you can do it. You've got a bright idea, go for it. There's nobody that can say to you, you don't need a certificate, you don't need a degree, you don't need anything in order to come up with the innovations that you want to do. So when you look at these cultures, it becomes very, very important to figure out why is it that we see the word no so much more often than the word yes. And with that, I'd like to bring up a quick topic. If you haven't really studied it, take a look at Jeff Bezos. In several of his books and articles, you'll see he talks about one major topic in the strategy that he developed. And that is asking not how to innovate necessarily or what's going to change and how do we change it, but let's start to think about what is it that won't change in the next 10 years. So he famously quipped that nobody 10 years from now is going to be complaining about spending less money on things that he is going to sell them, right? That's a pretty easy one to think about. Now, in the same way, when we look back to the 2008 campaign, and these guys were running 100 miles an hour, and as they came into government, they hit the brick wall and ended up slowing down innovation. Why was that? Because they didn't stop to think of all the things that we wanted to do, what's going to prevent us from going forward? What's going to prevent us from moving forward with the ideas that we wanted to pursue? Now, in that, how many of you know Dr. House, MD? Right? So House, if you remember back in the TV show, what were the things that he was worried about? Probably 3 different areas. And I'd like to discuss them each one because, again, think about innovation not so much as what can I do, but first what I can't do. And then that'll help us understand the other parts of this being the ways to say yes. So number 1, we always have to remember that regardless of how new something is, we can do no harm to the patient. That's going to be a central thesis. Every time you come up with a new idea, if somebody has even one way of figuring it out that might hurt the patient, it's going to stop you in your track. Safety first, reliability, these are things that you have to focus on. Now, number 2 is regulatory compliance. This seems pretty obvious, but if you want to find yes to many of the questions that you want to ask and the permissions you're trying to acquire, what are the things that are going to stop you on the regulatory side? If you have not thought through what those regulatory questions are, you're not going to be able to get a yes to things that you want to do in an innovative way. Next is intermediation. Now, this is something that we hate, but we know that we have to live with. Intermediation is simply the idea that you cannot just do what you want to do directly on your own. Somewhere, somehow, for example, a prescription is an intermediation for a drug. I, as a patient, cannot just go get any drug that I want. I have to get some intermediary, a physician, to do that. Nurses are often intermediaries in many areas of the hospital. So intermediation is just something that is baked into modern healthcare, and there's not anything we can do about that. So when you want to try to get to yes, which we're going to talk about a lot today, figure out if it's intermediated, how are you going to get around that intermediation? Intermediation is tied to regulatory compliance. How are you going to get around if it's tied to safety first and reliability and do no harm? And the last 2 that House used to always get into trouble with is that healthcare is still an eminence-driven environment. That basically means that who you are and is more important necessarily than what you can prove. Now, we don't like it. We would love to get rid of, but of course it's not going to happen very, very quickly. And the other area is that while there are evidence-driven decisions, it's also true that we're still consensus-based. So we just can't do things on our own because it's a great idea. So if I think back to my own computer science field, I don't actually have to ask anyone to do anything to create any app in any circumstances. Now, if I want to sell it into the market, that's a little different. But in actually creating it, I don't have to ask anybody anything, so I don't need to worry about these kinds of things in my particular profession. However, the last 20 years or so I've spent in healthcare, I have to worry about these things every day because my job is to create new things that get built and installed inside hospitals, health systems, and other environments. So now that we've talked about what won't change in healthcare, let's talk a little bit about what will change in healthcare over the coming years. What we're seeing is a transformation, almost a rebirth of the healthcare industry over the next few years. We're moving to an area where we're going to pay for outcomes. So instead of saying that I'm going to pay N number of dollars per N number of pills, instead I'm going to be saying, how much am I going to pay if these pills happen to cure my disease? Now, this is a massive transformation that most of us can't see yet. Leadership, if we're looking towards it to help us take us to the promised land of innovation, cannot help us. No one knows how this is going to work. No leaders are going to be able to tell you where things are going to go. And so we're pretty much on our own as professionals and generally as equals. Same place in my computer science career for decades. We're all in it together. We're all going where it's going together. So in terms of rebirth, think about it, like a newborn baby. We have to figure out our way, try things out, experiment more than we've ever done before. The big change is that we're going to be responsible and accountable for many, many things. So think about what is that responsibility and accountability? Well, like a babysitter is responsible for many things while she has a baby in her care. But a mother is fully accountable regardless of what happens in that babysitter's environment. So what's happening these days in healthcare is that we have to look at per patient and an entire population and be able to take responsibility for simple episodes that are occurring, and in addition, be accountable for the entire population, making sure that overall our population gets fewer diagnoses of diabetes, has lower weight across the population. So these kind of simple things are tied to both responsibility and accountability. Next is shared accountability for collaboration. Now, many of us know how to work barely within our institutions. As the institution gets more and more complex, we're not quite sure how to get things done, but we're getting better and better within our institutions. Over time, though, what's going to be required of us is that we work across institutions better than we do within our institutions. Why? Because we have populations to worry about now, not individuals and episodes. Next is that outcomes really do matter. Healthcare is changing in the way that it's going to deliver care in a shared way, but more importantly, we're going to be judged on what we accomplish, not just on the shots that we take. So the shots that we take, if they don't go in, if we don't get the outcomes, we may not get paid for it or not get paid for it as much as we would expect in the past. So in these cases, because outcomes matter, the way that we say yes to different kinds of experiments, the way that we understand the market, the way that we understand where we're headed in 2 or 3 years matters a great deal. Now, all of this is tied to risk and reward. So if you try to tie this to our risk understanding, we're not quite taught, whether it's in medical school, business school, how do you identify risk and how do you identify reward? So in the case of shared responsibility, we're going to be taking care of patients and populations. In the case of outcomes being measured and mattering more than they ever have, we're going to be measured in different ways. But how are we going to be able to tie this to risk and in a population is very, very important. And that is because we're being asked more and more to take further and further risk than we've ever been, especially in the provider angle. So many of you probably know there's only one funding source for healthcare, and whether that's insurance or anything else. It usually comes from employers, and at some point, those employers end up paying taxes, and then it goes to government, and the government ends up paying for a good chunk of it as well. There's one source of funding. That funding then goes through to payers, it then goes to institutions, and then providers. So the question becomes, how do we shift the risk, and how do we understand it in such a way that as the risk gets shifted, the people taking more risk end up getting paid more? So financial risk is growing. Financial risk is going more and more from the funding sources over to the patient. Many of you probably know that over the last several years, your co-pays have gone up, your deductibles have gone up. So that's because of the shifting financial risk coming from the funding over to the patients. The next is utilization risk. So it used to be that it didn't matter how many MRIs were taken, how many labs results you ordered, just didn't matter. But today, and especially tomorrow, the amount of utilization that you have is going to be tied to the outcomes and the money that you're paid for that utilization. That basically means order more, you get paid less, not order more and you get paid more. Very different than where we've been. And the last thing is performance risk. We've never had this risk before, but if you don't understand metrics and measures for how your patients are performing, you will over time make less and less money. This is why today healthcare leaders who are looking to innovate have a lot of walls set up that say, no, we can't do this, no, we can't do that because we're going to lose money here, we're going to lose money there. What we are trying to do instead is get them to understand that the shifting risks allow us to try new things. They allow us to say yes to a lot more experiments than we've ever been able to before. So the big question is, alternative payment models are coming, outcomes are coming through, so how are leaders supposed to adapt? Well, I say we use the formula. So you ask yourself, well, what formula? So here it is. Now, Stephen Hawking said once in one of his books that every time you show a formula in a talk or a book, you're going to lose half the audience. And I'm glad that you're all still sitting here, but if you stay through the rest of this, I think it'll be worth your while. Now, what I'm showing here is the L of V is the leadership value. That is, strictly speaking, your ability to say yes to things. And when I said today that leaders have to find ways of saying yes, this is how it's going to be done. So the leadership value is equal to a large, hopefully it's a large number, over 1, and it starts with the first thing, which is inquisitive curiosity about why things are the way that they are. The reason you're not able to say yes to many things is because you don't know enough about why things are the way that they are, and so you don't know that the reason that you're being told no is a bad reason or a good one. The second thing is that you want to have visionary strategy tied to problems and jobs to be done. Now, a lot of us go out and say, oh, this is a great idea, new app, new this, new that, but we haven't really tied it to an actual problem that's occurring within our institutions. So others around us say, what are you, crazy? Why would I want to try this? If you understand the jobs you're trying to do and the problems you're trying to solve, and then you understand why things are the way that they are, you tie that to strategy, now all of a sudden you become much more valuable. Communication and coordination. This is an area where we all lack a little bit. We come up with a great idea, we want to institute it, we want people to say yes to us, but we don't tell people how we're going to communicate and coordinate that so that it has success over time. The next thing is actionable technology that's truly transformative. Not a simple new thing that you would install here or there, but a truly transformative technology that is integrated into workflows. So this is really tough because we want new ideas, but we don't know how to put them in because they're tied not well to our workflows. The next thing is making sure that we understand performance, financial, and utilization risk. So if you're tying all this together and you don't know the risk, how are you going to actually get someone to say yes to you because you haven't told them what could go wrong? And lastly is workforce optimized execution. Not every idea, not every innovation can work in every institution. Do you know your workforce well enough and how you're going to optimize it in order to actually make the case that things will work? And lastly, it's the status quo. This is the thing that keeps growing over time. And if you don't change the top part fast enough, you get caught and your ability to say yes to things within your own organization and across goes down dramatically. So as you look at this formula, and as you look at this idea that we really, really have to figure out how to say yes, the question becomes, who's building your path to yes? If you are responsible for innovation, not your leaders, do you understand why things are the way that they are? And if you do, how do you apply that equation in a way so that your leadership value is a big number such that the status quo that you're trying to chase or avoid can be beaten? Thank you.